Okay, hi Gabrielle, how are you?
Hi, I'm very well, thank you.
Awesome. Um, Gabrielle, I'll just introduce you. She is a mama. She's also been a pediatric physiotherapist and has had some real genuine issues with eczema in her family. And she was kind of I guess going outside of the box in terms of her exploration around eczema and trying to heal it because what was in the box wasn't working. And so I just thought it would be an awesome conversation to have with you, Gabrielle, and just explore a little bit more about your knowledge around the topic and what you do and why you do it. So I thought just with the first question, I just thought if you could just share a little bit about yourself, what you do, and your specific purpose and what you do.
Thanks, Naomi. Yeah, so I'm Gabrielle. I have four little girls, and I live in the middle of nowhere in the Marlborough Sounds at the moment. And we are mussel
Nice.
farmers. So yeah, I've had four girls with a broad range of eczema, asthma, and food allergy issues. So what I do now is I help parents take control of their children's eczema naturally. Using a 6-week online course that I developed, along with I can do one-on-one coaching, I can do group coaching. Yeah, so that's basically the gist of it.
Beautiful. And how did you come to get this interest or passion and, desire to help other people in this particular area?
Mm. So I had my four girls with different issues, but one of my daughters in particular, Lucia, had just horrendous eczema, and everything I tried in the traditional medical model basically wasn't helping and was actually making her worse in the long run. Um, so I thought there must be a better way. I was just applying steroids as instructed over and over and over and over, and she was getting worse. So what I decided to do was to focus on finding the root cause rather than just trying to treat the symptoms.
Mm-hmm.
And
Beautiful.
what I wanted as well was I wanted to find a way that was evidence-based
Yeah.
because I have a physio background. I didn't want to just grasp at a lot of different straws. I wanted to know that what I was doing was actually going to work. So once I had found a pathway through and basically healed my children of their eczema, my Plunkett nurse or my public health nurse said, "Wow, you should write a book." Other parents. So I didn't write a book, but I did create a website and a 6-week online course. So I
Awesome.
just thought if I can help even one family not go through what we had to go through, then I'll be so happy. Yeah.
That's
So
amazing.
yeah, and I wanted something that was New Zealand specific, wasn't from overseas, and was someone who would hold your hand and guide you through. I remember thinking and saying to my husband, I'll do anything to help my children. I just need to know what to do. I just need someone to say, just do this, 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 and
Yeah.
this. I'll do anything, whatever it takes.
Yes.
So that's what I've come up with.
Yeah, and I think that's a good point because a lot of parents that have a child who's experiencing or suffering from really severe eczema feels that way, like help, just give me the things, I'll do it, I'll do anything. It's that kind of desperation, isn't it?
I
Um,
fully understand as well. I've been there. I've been them. Yeah,
yeah,
I get
for
it.
sure. And so, what would be three key benefits you would want a mother or parents to know about your natural approach to treating eczema?
I think the benefits are you're going to be searching to find the root cause of your or trigger of your child's eczema, not just covering up the symptoms. You're going to be avoiding a lifetime cascade ongoing prescription medications, which is usually
Mm,
what tends to happen. And you're going to have long-term healthy kids with putting in a bit of hard work. Short-term pain for long-term gain. Yes, it is harder work than just applying a cream,
mm.
but in the long term, it's of so much benefit.
Yeah, that's great. And just touching on that topic of steroids, and often it's like the quick fix option. But
Yeah.
what have been your experience? Because there's definitely side effects with any medication that you put on your body topically or ingest into your body internally. What did you find with steroids and the
So
use of
what I
that?
found was that was the first option that was given to us.
Mm.
The very first thing that happened when we went into the doctors was immediately, here you go, here's some steroids for these symptoms. Whereas knowing what I know now, I strongly believe that it should be the last option, not the first option. You know, when you've tried everything else, then you should be trying steroid creams. So what happened for us was particularly my worst child, Lucia, was put on steroid creams from 6 months of age. And then basically she was put on stronger and stronger creams, and we were given advice to apply them more and more often. And she became both allergic to the creams and addicted to the creams. So it's something called topical steroid addiction and withdrawal.
Yeah.
So she had to go through a horrible withdrawal process, basically, which was far worse than any eczema ever was. And so if I could encourage people to just right at the beginning of your eczema journey, to start off the most natural way you can. And then, you know, if nothing else works, then you move on to steroid creams. There's so much that can be done naturally that can help you avoid that pathway of stronger and stronger steroids.
Yeah, that's great advice. And I think that, I mean, being a Plunkett nurse or, you know, a well child nurse and seeing what's in the community in terms of eczema and what's going on, I feel the same way. And I think, you know, some of the side effects of the steroids and seeing that outcome is, you know, a bit of an eye opener, and you realize, wow, yeah, it should be a last resort call, you know. And so, like, you know, things like the thinning of skin, I've seen like children with severe scarring because the skin is just thin so much. Or the same as to what you're saying, what your experience with the addiction to steroid, and yeah, the inflamed skin, and that it exacerbates it or makes it actually worse than what you would be dealing with if you had, you know, stepped into natural first rather than the quick fix option of the steroids, which can sometimes be the longer challenge. Yeah.
Yeah, that's
So
absolutely right.
so is there anything that you could think of that parents should avoid when navigating eczema naturally?
I think the one thing that I would say to avoid is don't give up, because they're not quick fixes. These sort of
Yeah.
natural ways, natural methods are not fast, but they are sustainable. So if you
Right.
think, right, I'm going to try this one thing, I'm going to try a dietary change. A lot of people try it for a week and then give up. They don't see results. So I'd say
Yes.
don't give up. If you're trying something natural, give it a good, 2 to 4 weeks to see if it's going to work or not. Obviously, if you're trying a new cream or something and it makes you worse, then you would stop that immediately. But the biggest thing I would say is don't give up.
Beautiful. Okay, and so what's one remedy or skill that you could share with mums today so that they can do this immediately with their baby? Sorry, my phone is going off. With their baby or child suffering from eczema.
Mm. Um, there's been a large proportion of baby eczema has been found to be food related. Now, this is again, I was chatting to you earlier and saying there's a big difference between pediatricians, dermatologists, GPs, and other medical professionals. There's a split. Half of them say food has nothing to do with eczema, but a very large proportion says yes, food certainly does trigger eczema. And in babies, the most common trigger is dairy. And that's if you're breastfeeding, then that's in the mother's breastfeeding diet. So I would say the easiest things you can do, it might not be that easy for people, but is to try removing dairy from your diet. So many beautiful, delicious things like coconut yogurt and coconut milk, and there's lots of dairy-free alternatives at the moment, dairy-free cheese. I've got one daughter who's still dairy-free, so I know all of the options, but if you can try removing dairy from your diet and give it a good 2 to 4 weeks and see if that makes a difference. You don't have to, it's not too complicated. I would call it an easy fix. I don't know, maybe people would say that's difficult, but
Yeah.
straightforward one. So to try removing dairy from your own diet, and that may make all of the difference.
Yeah, cool. And with that, just out of interest, so in terms of nutrition, you know, obviously dairy, there's access to calcium, and so will those alternatives meet those nutritional needs?
So if you were concerned, you could talk to a nutritionist or dietitian about that.
Yeah.
But a lot of the things like rice milk says fortified with calcium.
Yeah.
And sesame seeds are a good source of calcium, sesame seeds and tahini. Broccoli has some in it as well. But you can get dairy alternatives that are fortified with calcium as well.
Beautiful.
Yeah, if it was going to be a long-term thing in your diet as well, for 4 to 6 months, then you'd want to start thinking seriously about that. But if it's short-term, if you're going to give it a 2-month trial in your own diet, then you're probably going to be fine.
Beautiful. That's wisdom. Now, last question I've got for you is how can mamas connect with you and learn more about healing eczema in natural ways and through your course?
A great question. So I have a website and I sell my course through there. I also have a Facebook page, and I've got coming up is I've got a free 5-day challenge called Ditch the Itch, where we go through every evening. Yeah, I'll talk every evening, and it's free. And you can go through and I'll go through a different topic every evening. And that at the end of that, you can either choose to keep going with me through there, or go through on your own. So the Facebook page is called Eczema Naturally, and maybe I'll write it down for you to drop a link in that as well.
Yeah, that would be awesome. I'll do that. Just one thing before we go, I thought as well, what is one way of soothing like some really irritated skin associated with eczema?
I would say number one, again, I say easy thing to do is get rid of all fragrances.
Yeah.
So have a look at what's in your baby wash, throw your baby wash away.
Yeah.
And just be using plain water and a neutral oil afterwards. Have a look at what's in your laundry powder and make sure there's absolutely no fragrances in anything that you're putting on your baby's skin or putting on your baby's clothing.
Beautiful. And I just had 2 questions from a mama who's really struggling with eczema. Should she be more active in getting him on solids to get more nutrients and vitamins into his body? And 2, would sunshine be more helpful for him with vitamin D?
I would say don't rush into solids. I followed a really excellent book. There's a New Zealand doctor called Dr. Julie Boselli. She's in Auckland, and she's got a book called The Nourished Baby. It's in my libraries. Yeah, excellent book. And she really doesn't advocate starting solids early, but she does talk about what to start first. She's a big fan of no grains, making sure there's protein in every meal. So that's, if you're wondering about when and how to start solids, that's a great book to follow. You can, if your child's eczema is related to any kind of food intolerances, then you can, potentially you're adding in more issues by adding in more food. So I wouldn't say start solids early to help eczema. I'd probably say the opposite. Yeah.
I think this baby is around 8 or 9 months, so she's pulled it out. She's pulled it out a bit, so it's probably something she has to weigh. Hey,
I would just say be aware of what foods you are starting solids with.
Slowly and slowly,
So one at a time, and look for reactions after each single food that you're adding on. I think that's a great book to recommend, Julie Boselli's. I'd recommend that.
I would too. That's awesome. And sunshine more helpful with eczema, do you think?
I would say in moderation. Sunshine is always going to be good, but not middle of the day, early in the morning or later in the evening. Vitamin D is fantastic for everybody. So
perfect.
In moderation. Too much sun is going to irritate your skin.
Yes, it will. Yeah. So thank you. I really, really appreciate your knowledge, your insight, your wisdom, and I look forward to talking to you again about this topic.
Thank you. Thanks for having me.
All good. Thank you.